Yes, I can tell. Usually I can tell, but it can fool me depending on how the gradient echo T1 with fat saturation sequence is imaged. It depends mostly on the scanner. There are some scanners that look they make a bright blood gradient echo T1s weighting. So we have even though there is no contrast enhancement, it looks like so it can be fooling. In these cases, as I always say, I always recommend technicians to do a pre and a post contrast T1 sequence, identical sequence, at least on one plane. Usually for lumbar spine, I do a sagittal pre and post, and if we have enough time, I'll do a axial pre and post also. But we can go through just the pre and post, so I can be sure that there is contrast enhancement. But usually, the most accurate way to tell if there is contrast enhancement in a MRI scan is to trust the technician. If you trust the technician and you look at the post contrast and it says post contrast sequence, you trust and you say it is. If you don't trust your team, you just ask, are you sure there is contrast enhancement in this exam? Because I can't tell for sure. And they are supposed to say, oh yes, it is. Oh, I'm sorry, I made a mistake. There is no contrast enhancement. I have gone through that a bunch of times. Sometimes it's impossible to tell. Sometimes they do too little contrast. Sometimes it's too shaky. Sometimes it isn't properly fat saturated. It depends on the case. If we manage to get through a contrast enhanced lumbar spine, I'll be sure to show you, okay? It really isn't common for us to get contrast enhancement because most of my MRI scans aren't from oncology hospitals, thank God. They are usually just outpatient MRIs, just chronic pain MRIs. But I remember yesterday I had a CT scan, not an MRI, of the lumbar spine, non-contrast enhancement, and it was major metastatic disease. They had a destroyed lumbar spine, and I was just thinking to myself back then, oh, thank God this patient could have just get a proper lumbar spine MRI with contrast enhancement. It could be much better than this CT scan right there. So that's a great question, but I have to tell you it's quite impossible sometimes to guess. I'm usually, if I have doubts that is contrast enhancement, I'm not going to say it does, because it's really easy to be wrong about it, and you can't really make mistakes such as that, because people like to sue, people enjoy bitching about it, and when they bitch, they make my life a tad harder. So no bitching is best.